Assalamu alaikum. This is Dr. Shebano. Hope you guys are fine. So I'm discussing an important topic with you guys, which is rosacea. Rosacea is a very common inflammatory skin problem that many people are not even diagnosed, and they have a complex skin type of structure. What is happening in rosacea? What symptoms you are going to see in rosacea? It is very common in the people who have fair skin, Pathan ethnicities, and this condition leads into the permanent redness in the form of the mallar rash, itchy eyes. All the time patients feel irritable, burning sensation, especially when they go in the kitchen, when they go out in the sun, or there are a few triggering factors that I'm going to discuss. And then there are visible small blood vessels on the skin, which is known as telangiectasias. The skin of the forehead, nose and chin become very thickened in the form of the beauty appearance. In that condition, what is happening? The inflammatory cells, the mast cells and the cytokines are releasing and creating this type of inflammation which cannot be sorted out by normal totkas or normal regimes. And very important, there is a mite which is known as Demodex folliculorum that sits on the superficial layer of the skin, which is epidermis. And it keeps on multiplying and laying eggs, and that's why the hydrofacials are recommended for the hydration and the exfoliation of this type of a mite. Triggering factors is something important to understand. What are the triggering factors for rosacea patients? Keep in mind it's stress, spicy food, sun, certain fruits, too much of the dairy product intake, hot waters, hot beverages in the form of the coffee or tea, humidity, indoor heatings, cosmetics, alcohol, and marinated meats. So please avoid the aggravating factors. Now what to do? We need to avoid the aggravating factors, and we have to put plenty of sunblocks as well. Step 1. Step 2 is you must go and seek the advice of a very good dermatologist. And in our practice, we usually give the metronidazole cream, sometimes ezalic acid, the clindamycins. In oral treatment, we prescribe the tetracyclines, doxycyclines, and in severe conditions, we give the tablet that is isotretinoin. But keep in mind, this is something that you don't have to follow by yourself. You need the prescription of an authentic doctor to help you. That must be a dermatologist, right? And the third line treatment, which is very helpful even in my practice, that I have seen improvement in just 3 sessions, is a pulse dye laser. That is a V-beam perfector. We do it 1 month apart, and they are more than enough to treat this condition. Keeping in mind that this is a recurrent condition, it can come back again. So maintenance is going to help and relieve the symptoms and make the quality of life much better than before. Hydrofacials are recommended. In few of the patients who need very acute results, we keep on doing some small maneuvers as microbotoxes that gives result in just 3 days by combining it with the IPL light, that is intense pulse light. I hope my video was informative, and I'm sharing few slides as well. And for any type of help, for any questions, please drop your message, so I'll be helpful and I'll enjoy my fruit. You guys take care of yourself. Bye bye.